Hello. In this section, we talk about physically active lifestyle. In the Chanwi Lifestyle Medicine program, the participants are encouraged to maintain physically active lifestyle and to reduce sedentary behaviors. So what is sedentary behavior? Sedentary behavior refers to any walking behavior with an energy expenditure less than 1.5 metabolic equivalent. Sitting in front of TV or computer, laying down, watching TV are those type of sedated behavior. Maintaining a physically active life is not difficult in ancient times when farming and manufacturing are major economic activities. And walking is also a daily routine as vehicles were less common. However, being physically active become a big challenge in modern lifestyle, as most of our work or leisure activity require using a computer or mobile device. Some study in the United States has shown that adults spend on average 7.7 hours per day in sedentary behavior. Sedative lifestyle is a leading cause of death and disability. It is a significant public health issue. This type of lifestyle increases the risk of cardiovascular disease, cancer, high blood pressure, depression, and anxieties. World Health Organization issued a warning that sedentary lifestyle could be very well being among the 10 leading causes of death and disability in the world. Some people think that we must go to the gym in order to be physically active. Now let's talk about physical activity and exercise. Physical activity, as World Health Organization define, as any bodily movement produced by muscle that require energy and expenditures. Working, playing, doing household tasks, traveling, or walking are all physically activities. Exercise is a subcategory of physical activity which is planned and structured and repetitive, aims to improve and maintain one or more components of physical fitness. So be active throughout the day. In the Chanwi Lifestyle Medicine program, we encourage participants to be physically active during the day, in addition to having a planned exercise program. The program emphasizes on doing more walking, standing, taking stairs to increase physical activity in their daily living. The program followed the recommendation of the frequency of physical activity as stated by the World Health Organization. For children and adolescents aged 5 to 17 years old, should do at least 60 minutes of moderate to vigorous intensive physical activity daily. Physical activities of amount greater than 60 minutes daily will provide additional health benefits. It should include activity that strengthen muscle and bone at least 3 times per week. For adults aged 18 to 64, should do at least 150 minutes of moderate to intensity physical activity throughout the week, or do at least 75 minutes of vigorous intensity physical activity throughout the week, or the combinations. For additional health benefit, adults should increase their moderate intensity physical activity to 300 minutes per week or equivalent. Muscle strengthening activities should be done involving major muscle group on 2 or more days per week. That's the end of the section. Thanks for your attention.